see who is on. Is it on public? Let's see. Let me see. Hi, how are you doing? Good morning, good morning. It is after 10. All right. I was wondering if the live wasn't going to be going out because I know it was listed. It was labeled unlisted earlier. So I'm happy that I see someone pop on, which means it's working. All right. So I know today is, let me get this signal. Oh, I need to figure out how to get this thing. How do I put that post down there? Hi, how are you? Thank you for joining in. You can always tip. Where else can share it? So I see so much different when it comes on to the folks popping on. Yeah. Because it's like you'll be on YouTube for a long time and nobody shows up. And even if somebody does show up, they don't say hi. You know? So, but I am going to go drive. Hi, how are you? I'm going to go and see these patients that I have. All right. Where are you joining in from? If you don't mind, just say hi. Oh, the person run gone. Yes, may I tell you? Like, it is so weird here on YT. But then, I'm not complaining because YT or YouTube is the place where I started my first live. So I'm not complaining. But I tell you, when you compare it with other platforms, you will realize that it's a little bit different. It's a little bit different. And that's just it. It's so different in terms of how the other platforms, operate. But yeah. All right. Probably should put the phone up a little bit. Up here. Yeah. This is a little bit better. So I can not look at the phone, but put this other phone right here. All right. road is so loud. Loud, loud, loud. Hello, how are you doing? Just a hi. Say something. You understand? Just come and just run off of the live. My God. Oh, Lord. But yeah. Anyways, let's get the content going. So as I say in all my videos, if you're new here, my name is and I'm a nurse. I do house call as I do house call as a nurse practitioner in around Texas. Yeah. So today is no different. I am on the road because I do a lot of driving. A lot of driving each day. So I am heading to see. This will be my third patient. I've gone to see two other patients, but they weren't there. They weren't confirmed, but I was too close to them, so I said, let me go and check in. But one is in the hospital. The other one was in the hospital and then went over to get physiotherapy done. So I said, all right, then I am just going to just stop by. So I will definitely do like post-hospital visit follow-up for them in the upcoming week. And then from there. So it is 10:30, 10:23 now. So it's not bad. It's 10:23, and the road not so bad. The traffic not looking too bad. So that's a plus. Where is this? So another patient that is admitted that I came to visit, she was recently diagnosed with cancer. So she had seen her specialist. She saw the oncologist about a week and a half ago, and then she got cardiac clearance. So she had to have a clearance for her procedure. I was so excited to know that, she went in and had her surgery done and looking to be discharged. So that's the good thing about, the American system here. If you have good insurance and if you have, you're following up with your providers, you're doing a preventative care, you realize that you get in to see your providers and get in to see, get any testing or procedures done in a timely manner. So I was kind of surprised because that was like less than 2 weeks ago I saw her and she was going in for her appointment. So to know that she's in the hospital now after getting that diagnosis for cancer and then removing, doing her mastectomy, that is just impressive. That's just impressive. But I know she does have Medicaid insurance. Don't know the other insurance that she has apart that. But she does have Medicaid. And then the other patient I saw or would have seen was for a follow-up to the emergency room, just the same. So he had a fall a couple of weeks ago. Oh, 2 weeks ago he had a fall. He bumped it was his the right eye on the table. But the thing about it is that he just had cataract surgery, and so he was a little bit concerned about it. I was concerned about it as well. So I told him going to the emergency room because I don't know if there is any bleeding or anything going on. He was having some pain, blurred vision, and just to know that you had, cataract surgery just a while ago. You don't want to be a case where something is going on in terms of complications and you leave it untreated, So he went in and they did CT scans, they did MRIs, and everything came back normal. So he was discharged, which is good. Alright. So the next patient I have is like 8 minutes away. And usually they're not that far apart. Some days you'll have them a little bit farther than usual. majority of the time they're in close proximity, so can't complain. But they're very close, we get a chance to see more patients, but then you don't want to see too much patients because you're gonna have a lot of charts to do after, and that's where the bulk of the work is. So yeah, so I think I have 3 annual visits to do on them. I think there is one that is a hospice patient. I don't know why I'm seeing that hospice patient, but I keep on telling them, but they keep on putting the patient back on the list. Yeah, they already have a provider for hospice service. So usually we can, you can collaborate. You can see them, but you try not to do any orders or anything because really and truly they don't do any orders for hospice patients. So yeah, they're not going to be doing any extra tests or anything. It's more palliative care, pain management, things like that you're doing for them. So sometimes I just feel as though if I'm seeing them and they have a hospice team that is already caring for them, it's like a total waste of my time, in a sense. But at the end of the day, I'm not doing it for free. I'm getting paid because I was told to go and see the patient. So, yeah. All right. So I guess I need to go ahead and start, pre-plan, schedule my live. The persons can be a little bit more aware of that. That's one thing I'm working on. So definitely working on that. Because if not, then you're gonna have people just popping in and out, and nobody's staying for the live. Nobody's not staying for the live. So that's just it. But either way, when you post the video, when you post the content, it's not like nobody knows that nobody was watching at the time, right? Oh Lord, what's not going to know? Or they don't know the amount of person that is on the live at that time. So it's just that it's a little bit more encouraging when you see a lot of persons on your live, being very interactive and all. So that's just it. But I guess, because I'm not talking about certain things on my live, why you're not going to really have persons hanging out so long. Or, yeah. And that's just the thing. And I think it's the same thing for me as well. Like, depending on what persons are presenting on, it might not be a topic that I'm interested in. They might not be that funny, so I might not stay on their lives. So I guess it's the same thing, that is happening here. Oh, I need to go by that side. Alright. So, yeah. I think I go on the wrong road. Okay. Let's see what this money man decided he's going to charge me now for all of this school. Oh God. Alright. So, made the wrong turn. So, GPS already. They're bringing on all the expensive tools. Yeah. Because I can't stop to reprogram this thing. So, it's going to continue taking me. So, it's going to charge me a few bucks. So, turn back in a sense. Yeah, but I hate it here sometimes when I'm driving in Dallas. Dallas is so complicated. And then they have so much roads that they're building, new development. And I'm wondering if the GPS not pick it up. Like, they'll tell you go left, go right. And when you look left and right, the roads on on the left side or the right side of the road, it block off. You understand? So you have to be like trying to figure out where to go from there. Alright. So my 3 minutes drive eventually turned into 7 minutes. Okay. Alright. Yeah. You know. Probably should play some music to keep me company and keep you guys company as well. Alright. Yeah. Hi, how are you doing? Alright. So 10:33. I think I have 3 more patients to go. And then that's it. So hopefully by midday I should be done. Yeah. Should be done by midday, and hopefully, everybody will be out on lunch. We'll be out on lunch, so hopefully they'll come and join the live. Because, at that time everybody decides to start scrolling. Yeah. Start scrolling at that time, so they will be out to see who is online. And hopefully I'll be online. Yeah. I have some notes from yesterday that I need to complete. And then I'll do these 3 as well. That way Thursday is a pretty easy day for me. That's what I always try to do. Complete the notes in a timely manner so that way it doesn't feel as though I am stressed out at the end of the week trying to complete all of these notes. Yeah. So I think that's the hardest part of being a host scholar and practitioner. Yeah, when you're supposed to do all of these notes. So you spend the entire day seeing patients. You laugh, you smile, you make up your face, all of them things there. And you go home and then drown yourself in all of these notes. Like it's annoying some days when I like, yeah, I miss the emergency room, the excitement of the emergency room. Yeah, because at that time I wouldn't need to be like coming home and doing any more notes. Once you the patients, then we're done. That's it. But doing this is a little bit better than the emergency room because I have the flexibility and I get a chance to go to different communities and be inquisitive sometimes, just drive around and see how things are. Yeah, especially when you're an immigrant, let's just say, you're kind of curious. So that's it as well for me. I go into some communities and see things that probably I wasn't expecting. And it's more of an eye opener for me. So I appreciate where I'm from a little bit more because at one point, I remember growing up, it was more of, you want to come to America, you want to get on the Iron Bird, you want to come to America and live because, you just feel as though it's better than where you're from. But then I realized it's not like that. Some people have it so hard. Some people have it so hard. It's so sad. So sad. You look at it and you think that your life did hard or your life did tough. No, stop. You were living in luxury. Or if you're watching this and you're thinking, your situation hard or tough. No. Some people out there are having it really, really rough, difficult, hard. Some people can't buy food. Buying noodles every day. Every day they might eat noodles. Like, I never see so much noodle in my life yet. Like, yeah, you eat noodle, you eat a cup noodle and you eat it and you say, okay then, yeah. You eat it for school, when you go to school. I never know the people gonna eat noodles morning, noon, and night. You understand? No. So things like those, it open up my eye a little bit more wider. I mean, my eyes them big, but yeah, I see things differently, and I come to appreciate a lot about life and growing up where I'm from, things like that. So I don't know whoever is gonna be watching this, you know. Don't feel as though your situation is bad. Yes, you want opportunity, you can take it when you get it. But make use of what you have. Because sometimes people come over here and they see things and it changes your mindset, your view. Seems to have a patient somewhere of what has been happening all of this time, in your life. Because as I say, sometimes we complain a lot about our struggles, our situation, and yeah, people who are just worse off than you and I. So give thanks. Yeah, give thanks. You're probably in a one place that you have your neighbors that you can go over to your neighbor and say, neighbor, that things hard. I can borrow this, or lend me some flour, lend me some sugar. You can pick something and your neighbor not shoot you. You know them way there. You probably live in a place like that. Yeah, persons up here, they don't even know them neighbor, much less, go over and say, hey, can I borrow this, or may I dead be hungry, can you give me a plate of food or something like that? No, I'm going up here. Like I'm saying, like you have so much bigger, establishment. The mercy there fast people them stuff. Make a turn. I make a U-turn here. I think so. You have so much big establishments here, and one thing you realize is that there's so many people who are suffering. 3-1. You have so many people that are suffering in this place here. Them are going them bed and them can't find food to eat. Alright, so you understand? And that's just the reality of a lot of people of this side. Especially this population, a lot of okay, this light is seem like it continues. Alright. Where am I going? Kind of missed my stop. Apartment drive from 3-3. I'll come over this side. Yeah. And that's just it. I understand. 3-1-2. So yeah. So you're not supposed to be talking while you yeah. But that's not, I think it's as long as you're not looking in the phone and reading the comments, it should be fine. What do you say? Yeah, that's so. Alright, let's go again. But yeah. But it's sad. It pains my heart like every day. It pains my heart like every day seeing people in some of these situations. Um, pains my heart to see people in these situations. And as I say, it's not a case like you can just pick up yourself and say, okay, you're gonna go over to your neighbor house and ask them for a little help. I guess if you're in the poorer section, the poorer communities, I realize that you have that relationship amongst, you know, the patients, not necessarily the patients, but the community members. When you talk about the middle class and all, it's hard for them. It's hard to keep them along in the lower class, the communities, because you realize that neither the two neighbors that them live beside can't help each other. You understand? Them can't help each other. Not just it. Can't help each other because a lot of them not working or them sick or something like that. I can't go past this one. Let me mute you now. Try to we can't park here, so let me mute you a little bit. Sorry. All right, so I am gonna run and see this gentleman, and then from there, I'm gonna still leave my live on running, just in case anybody shows up. All right. So I'm gonna go see him, and then I'll be back. All right, so I'll be back where we can chit chat a little bit more. You can always go ahead and ask any question. I'll answer them when the time is right. All right. So feel free to do that. How are you guys doing? How are you doing? This is something to say hi. Okay. All right. So I don't know. So I have a patient that is on hospice. It's weird. So I just met her. She's on hospice for, she says, 8 years. I don't really understand how she's on hospice for 8 years. But anyways, you know, she's on hospice for 8 years, and she wants everything under the sun ordered for her, as if she don't really understand the hospice service. And even when I tell her, she complains that certain things I can order, but you're not gonna get them. The insurance is not gonna pay for them. You know? So the other day she wanted to go to the hospital. So the hospice team told her that if she goes to the hospital, then she won't be able to continue with the service. She would have to get renewal or recertification. And she got upset. But anyway, she went into the hospital. The same complaint that she had for years is the same thing she went into the hospital regarding, and they treated her the same thing again, same diagnosis, arthritis. And it's like, I don't know, but she's on like a lot of pain medications, which is okay. But she wants me to refer her to a pain specialist. And I'm like, if hospice is already dealing with your pain, I'm not going to refer you to pain management. Like, that doesn't make any sense. You know, she wants more fentanyl. She wants a higher dose of fentanyl because the one that they're giving her is not enough. That's the one that hospice is giving her is not enough. And they're only giving her 7 days supply each time from the pharmacy. Like, that doesn't have anything to do with the providers or with me. It has to do with probably her insurance. Her insurance probably saying they only should dispense probably 7 days supply each time. But I don't know. When you tell patients all these things, they do get upset. They do complain and they feel as though you are the problem. But we can put in all the orders, but it doesn't mean that you'll get them. You may not get them approved. Because as I say, she's on hospice for 8 years. I've never really seen anyone on hospice for 8 years. That is just ridiculous. But, yeah. If she needs additional, testing, if she wants to go see different specialists, if she wants to get MRI, CT scan done, she's going to have to come off hospice service and then get those testing done if they're approved. But if they're not approved, then, but she don't want that because she still needs her pain medication. All right, so I'm going to go in and see this gentleman. It's an annual visit. I saw him the other day. Nothing really going on with him. So he's going to do his annual wellness visit, and then from there, I know pretty much like, his history already is lab work. So I can fill those in. There are just certain questions they definitely want to ask them. And in terms of preventative care, you'll discuss with him regarding like, colonoscopy, getting his well, we do the PSA, which is the prostate. We do testing for the prostate. I don't do the finger, I do the blood, the blood work. So we do that, and then depending on what's going on, usually we'll refer them to urology. But if the numbers are looking good, they're responding appropriately to their medications, then usually you don't really need to do anything. So we usually try to encourage them to go in and see, like, a GI specialist, or just get their colonoscopy done if they haven't done one in, like, 10 years, or if they've had one that was negative. We also do their PSA. We do, like, the heart test, regular cholesterol, lipid panel. We do urine test, regular blood test. For the females, we do mammograms, or we encourage them to do mammograms. So all of these are like preventative testing that we do, and we encourage them getting their vision testing done, their dental work, things like those, so we can identify from early what is happening, and then from there treat. If everything is good, usually we just continue with their once a month management. A lot of them are like diabetic, they have hypertension, so we do like chronic care management for them, and just make sure that their numbers are looking good in terms of their blood work, their kidney function. They're taking their medication, they're compliant. A lot of them are depressed, so we try to make sure that we have a psych provider that comes in and sees them. What else? We have social workers that we do refer them to get additional things. Because some of them, as I said, they need food, they need clothing, some of them need a mattress, they need like tons of things. A lot of them need, a lot of things. And so we work along with social workers to try and get those done. We try to get like meals on wheels for them, deliver their homes. Work along with, the home health services. So we try to do physiotherapy for who gets, approval for that. We also do occupational therapy, because some persons might need like wheelchairs, some persons might need boots, different things. We can get hospital beds for them, Hoya lifts, incontinent pads, and all of those are going to be based on their insurance. The ones that, it affects a lot is, the ones who don't have Medicaid. Is Medicaid? Medicare. Yeah. It affects them a lot because, I don't know. I'm still trying to understand insurance, but insurance is so hard. It is so hard, but not until you get into the field you realize how difficult it is for some persons if they don't have that supplemental insurance. So sometimes they might hear the patient so that they have, Medicaid, but that's not good enough for them because they might need a secondary insurance to go with it to get all of the benefits. All right. So, anyways, let me go ahead and go see that patient, and then from there I'll come back and then we can have a little discussion as well. Yeah, we'll have a little discussion, and then from there. So he has, like, most of his concerns are like GI wise. So he's on a few medications for that. He's pretty much stable, and he's known to have arthritis, and he has a stroke as well, but he has some deficits. So he does have a home health aide, a nurse that comes in. We do physical therapy with him, and we get medications delivered to his house for him, and then from there, a lot of times they don't really spend that much money out of pocket. But when you hear somebody say that, $10, they can't find $10 is a lot, then it really means that the situation is that bad. And another thing about it is that some of them might have relatives, but the relatives are not always there, or, yeah, they're not there any at all. And sometimes they live really, really close by to the relatives, and it's like they don't have any assistance. And that's just the situation for a few of them. But overall, I feel as though, what is that? Is that like a bubble? What is that? That's weird. What is that up there? Let me take out this phone. That's weird. Looks like a bubble, but why would a bubble be that big? What is that? Well, it looks cute. Where is it? Why would a bubble be like what is that's weird. So I see something looking like a bubble. You know, like when you do your regular bubble in the sky. Let's see anymore. Anyways, in a burst or anything. I don't know what it was, but it just kind of looked weird. Let me show you this. I don't know if you can see. Is that thing there? Yeah, I don't know what it is, but it's actually that was just weird. That was just weird, and it doesn't look like a drone. Hi. This is what I see a while ago. I don't know if you can see it. It's in the sky. I don't know what it is. Kind of look cute though, but weird. All right. I'll see if anybody else sees it. All right, I'm gonna go in and see my patient, and then from there I will see you in a few minutes. I'm gonna keep my live on. I'm gonna mute you guys. All right, just in case I come back in and I'm dictating. At least you don't know what I'm dictating about, or yeah. All righty. How are you doing? I'm gonna run and go see this patient, and I'll be back shortly. Let me just type it in the comment section. I don't want to end the live, so. How are you doing? I'm gonna run and go see this patient, and I'll be back shortly. Alright. Let me just type it in the comment section. And let me pin it. I don't want to end the live, so. Alright. And you can go ahead and give the video a thumbs up, you know. It's not gonna hurt. Alright. But until then, give me a few minutes. You can always circle back around, alright? I have a tablet. So on my tablet, it has a keyboard on it as well, which is good. So I can type real nice when I'm there. Then I have my little plastic bag. I have my mask, blood pressure cuff, pulse oximeter, thermometer, and a stethoscope in this bag. That's all I walk with. Usually it's a little bit smaller, but this one I can actually put it on wherever, the countertop or, you know, or so. And I have wipes as well. I can put it on the countertop or wherever, rest my tablet on it and just, you know, do my little thing and then step out and start wipe down. But that's about it. All right, let me go. Hi, how are you doing? The phone is like so hot right now. Yeah. Hi. So it was cooling down a little, so it shuts off for a bit. I was trying to go on the other phone, but I guess it was already stuck to this phone. So, all right. I'm gonna just dictate this thing. All right. So I'm gonna go to my other location, and then I'm gonna go to my other location, drive to my other location, and then from there, where's my pen? All right. So that's one. So this one is in hospital, and then just saw this one. Need to do med refill. Let me see. Hello. This spam calls. It's annoying. All right. So let me go. Okay. So the timer gets a little bit warm out. So this one's gonna be 3 minutes away from here, and then from there, 6 minutes rather. Yeah. So I'd have to knock on his window because he's always in the bedroom. He says, and it's difficult for him. And then I'll do one televisit. Ooh, I think I shouldn't be on this. Last thing I want to do is get a puncher down this section of the location here. The other day I was driving and I got a flat tire. So it was more of I just gotten the tires changed on the vehicle, just got the tires changed on the vehicle. And I was like, all right, let me just drive it and do see some patients. So I was on the highway, and it was a good thing I got the tires from Walmart. Because Walmart did have, or they have this thing where if you buy the tires from them, you can get the warranty. I think it's lifetime warranty on the tires. So it's okay then. Seeing that I'm doing house calls, what better, you know, option is gonna be out there for tires in terms of warranty? Like, okay, so I went ahead and changed the tires and was driving while I was going into this because I had this patient that was in like one of those RVs. So it was like a RV little center. What do you call them? The park. So there was a patient there who was living in one of his, in his RV, but his RV is a little bit old. It has been there for like years. Let me tell you, the RV full of soda can. No, so I said to him, I said, I never know you work for, I think it was Coke, Diet Coke he had. I said, I never know you work for Diet Coke now. Why you have so much can inside? This is all I drink. This is all I drink for breakfast, lunch, and dinner. And I'm like, whoa, I've never seen so much cans in my entire life in one location that is not like, yeah. So anyways, I was kind of backing up or pulling up close to his RV because I wanted to position myself properly. And I didn't realize I was that close. There was something that was sticking out from his RV, and I tell you, it chopped the tire, literally chopped the tire. So I had to call roadside assistance. I didn't even drive on the tire for 24 hours good. I had to call roadside assistance, and that's the good thing about my insurance. I do like them. They always have people all over. So I use Geico, and this is nothing to do with any, but I've been using them for years since I've been here in the state, and it has been good. It has been good. So the tire got chopped. I want to tell you, say, like I could hear the tire just go like, psh, and that was it. And I was there, and I'm like, what am I gonna do? Because I was in Dallas, somewhere in Dallas. What was I gonna do? And I called, and then they said the wait was gonna be like 1 hour. But this old man, instead of him a mechanic, so he wanted to go ahead and switch out the tire. But me never realized there is something that I should have located from before for the wheel, for the tire to actually come off. Yeah, them have this key that I always see the thing in the car, and I never know that it was a key to pull off the little, how you call them, the nuts, whatever them thing there on the side of the on the wheel. Yeah, when you put on the tire, you're supposed to lock on them. The Subaru has it on the tire here, and I never know that I had to get something to open it, to screw off them. So I always see this thing in the car. I mean, mad to take it that way because it just never served any purpose. It was just a piece of iron that I was like, why is this just like thrown down in the car? It's always in the glove compartment, and it's always bothering me. And I'm the kind of person like that sort of thing. Like if there's no use for it, I just like literally throw them away. But for some strange reason, I didn't this time around. Alright, you go. Let me go over that side. I didn't this time around. I kept it in the vehicle, and I was looking for it. So I had to make a few phone calls to find out what is it that I was supposed to use to screw off the tire off the vehicle. So when the mechanic came, he was asking the same thing. And I was like, I don't know. And he was like showing me. It's like, it's supposed to look like this. And I'm like, oh. So I was so very glad, and I went and got it. And from there, we were able to take off the tire and then brought it back to Walmart. But then Walmart now tell me say them no have under warranty. This a big chop. The big chop on the tire is not covered under warranty. And I'm like, you guys never really say exactly what the size of the chop is gonna be, or you never say exactly how big it's supposed to be. You say puncture, but you don't know what me drive over to puncture the tire. You understand? But anyways, they gave me a little bit of a hard time, but eventually they took back the tire and gave me a new one, and so that was the end of that. But as I say, it's nice because I am doing so much driving. I wouldn't want to be driving and then driving around with a donut for the entire day. No, so it was a nice little deal they have, so I just take it. Because then I can just drive up to any Walmart and basically just tell them that the tire need replacement, and they will pick it up that I have the insurance on it, or it's under warranty, and they'll give you a free one. Alright, so definitely that's a plus. I've only had a puncture tire once before that, Well, a flat tire once, and that was when I was going to this place called Nacogdoches. Was doing a travel contract there. Professional park beside this fire hydrant park right here. Hmm so now I'm at this patient's home. I have to go knock on the window because he doesn't, hear the door when you knock on it, and he doesn't have a call bell that rings. So he's like, come and knock on my window, beat on my window when you get here. I'm like, okay, no problem. So, yeah. So he needs to see a neurologist, but him just feel as though I'm not supposed to see one. So I don't know. Like a lot of times, you're probably talking with these patients, and sometimes you just have to shake your head and be wondering, okay, then, like, you want the service, you need to see the specialist, you want to see the specialist, but at the same time, they give you a hard time. So he has had, like, a surgery before, and he feels as though his his surgical site is giving problem, and he wants to go back in to see the specialist because he thinks that there's some shift going on. And I'm like, okay, then no problem, go ahead and do that. The gentleman said no, I'm not gonna go in until him start vomit and whenever him start feeling nauseous and him having headache. I said, okay, okay. I can't do it anymore. I just come see them, educate them, and from there they can take the word and do whatever they feel with it. But a lot of them will tell you they're not gonna see the specialist until basically until the complications start, and that's just it. Because if you have hydrocephalus and if you feel as though your shunt is shifted, like you want to go in and get that sorted out from early. But he says no. Whenever I start vomiting, whenever I start having the headache, I'm like, oh, okay. You know what? All right. Let me run in and see him, and then from there, um, I will come back and have a chit chat. I'll continue talking. All right. Continue talking from there. But this little spot is so cool. I feel like I could hang out right here and do all of my life for the rest of the day. Mhm. So that's what I'm gonna do. I am gonna go in. This person lives by himself, but he has some really lovely neighbors. So like whenever they deliver anything, the neighbors normally come over and take up the package, bring it in, help him with fixing up his place, cleaning, and all. These are not rich folks, all right? These are not rich folks. These are just normal people, all right, helping out each other. But he says he doesn't need anything. I think we tried to get him like a home health aid. He got approval, and then I don't know. I think let's just say money run out. You know them way there. No, no. Or probably he changed his insurance, and then that causes problem with his benefits because a lot of times that is what you realize happen. Sometimes they get this call and they'll get the call to say, oh, we can get you $250 extra if you sign up with us, this insurance company. And so a lot of them, because they really need the $10, they want the $50, the $250, they definitely go ahead and switch over their insurance and don't even realize that they are going to be missing out on so much things that are beneficial for them in terms of like, what service we offer. So a lot of them will definitely go ahead and just run for the money and then realize that their diabetic medication never get covered under the new insurance plan that they signed up for, or certain medications for their dialysis, their high blood pressure, their heart medication, just because the insurance is saving back on some of that, but giving them that $250. And because, when we're going to say when you're poor, when you don't have it and you hear somebody say we're going to give you $250, you run for it. You understand? You want it, so you go ahead and take it. But you're not thinking about the fine prints of what are some of the things you're not going to be getting as a result of you taking on this new insurance. Because These insurance folks out there, they are out there to make money. A lot of times it's not to benefit the patient. You might find one and two of them that calls the patient out of, the interest of the patient. Try to get the patients that extra $250 plus everything else that they have with their insurance plan. But you have some that are just out there that are just hungry for money, and them just know that if they can upgrade the patient's insurance plan or switch them to a different plan, they're gonna get like probably an extra $500, $1,000 in their pocket, and then in the end, the patient is left, with all of those benefits that they're supposed to be getting. And so, a lot of times patients are, they're thinking that we're doing good for them, or they feel as though we know best for them. And when you say something to them, a lot of times they will just go ahead and take it as gospel, and that's just it. But a lot of times they are fooled by some persons that are out there that are just hungry to get these patients to sign up for certain things in order for them to make big money in their pockets. And it's just unfair. It's just unfair. Like everywhere you turn, the patient gets screwed. Everywhere you turn, the patient gets screwed. From the host call service, from the insurance provider, the pharmacy, like every single corner you go, like the patient is always the one that is getting screwed over. Nobody not looking out for them. Everybody just looking out for profit, 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 and the patient them just a dead, dead, dead. Like it's unfair. It's just so unfair. But anyways, let me go in and see him, and then I will be back. All right, I will be back. I'm not gonna hang up the live. I'm not gonna close the live. Yeah, I'm not gonna close the live. I'm having you guys keep me company. Whoever comes on, keep my company, and then from there, I'll be done for the day. All right, so I'm going to see this gentleman. Then I have one more patient. That patient is going to be like a 90, he's like 93 years old. Very sweet person, speaks Spanish, but the relatives do speak English. So, that's a plus for me. All right, let me go. I need to put on, so I never walk with my jacket. I took the jacket out of the car because that jacket was just a little bit too close. I never replaced it this morning. So I don't have a jacket right now, and I really needed one for this house. Hi, how are you? Yeah. All right, then. I'll be back in a few minutes. You can circle back in 20 minutes, all right? Just saying, if you're interested. Just circle back in 20 minutes. Let me go in and see this patient. I'm going to spend about 15 minutes with him. He's one of those patients that I've seen like every month. So basically know the ins and outs with him. Just checking to see if there's anything that has changed. So a lot of times we just check to see if if they've been to the hospital, if they've seen any new provider, followed up with the specialist to encourage them to make sure that they're eating properly. Find out if they've had a fall, if they have any sores, wound, as I say, recent hospitalization, if they're having any complaints, that we need to address. And most of them, their medications are refilled for like 3 months because it's easier as well as cheaper for them because the insurance prefers like the 90-day supply on the medication. So it's cheaper for them. If it's like a new medication, usually I will put it in the comment section of the order to say dispense only 30 days because it's going to be a trial for the patient, but you still want a patient to get the cheaper rate on it. You understand? So if I still send out for 90 days, I would say just send out 30 days supplies. The patient still benefit with the cheaper pricing for the 30 days supply of the medication. And then from there, if it is something that we need to continue, then I'll continue it. If it is something that I need to discontinue, I just discontinue it and find something else to give them. But basically, that's about it. The visits are not usually that long. A lot of times, you might do referrals. And as I say, it depends on what is going on. You go ahead and do referral. Not everything you refer out because you can, you start your medication, see how the patients are doing. If you realize that in terms of their blood work, they're trending down or the opposite direction, then you can decide that, okay, then this one needs to go and see this specialist or, or not. But not everybody you refer out because after a while it just becomes so annoying and it feels as though you're not practicing as a nurse practitioner. I mean, I want to do as much as I can for my patient because sometimes when I send them out there, a lot of times they don't even get in to see a specialist. specialists might take probably like 3-6 months before they do get in. That's what you're going to do. Leave the patient out there just hanging. No, like I manage them as best as possible up to the point where if I am maxed out on their medication, that they can get or things that I can do for them, because at the end of the day, it's still cheaper for the patient. The whatever you're offering is supposed to be cost effective. It's not supposed to be costing the patient an arm and a leg. And we all know that when they go and see a specialist, they're spending anywhere from probably like $250, $70, $250, depending on your insurance that you have out of pocket to see those specialists. And a lot of these patients don't have it. So you do what you can, and then you refer out what you definitely cannot manage. You realize that the labs are just abnormal from day one, then definitely send them out. You understand? Refer them out to the specialist and let them see them. But if it is something that is mild and you can manage them, you can monitor them, see how your medications are doing with the patients, then that is the route I usually take. And I will say, this is going to be the plan. Ultimately, we wanted to see endocrinology. If you have the money, you can go. But it's not like something that I'm saying, yes, you need to go today. So from there, if they have a wound, then we have wound care specialists that comes in to see them. And it depends on, the stage of the wound. You might have an advanced nurse practitioner that comes in and see the patients, or you might have a wound care nurse, like, from the home health service that comes in and see the patient. So it depends on the severity of what is going on. So they do get a lot of things going. As I say, if they have good insurance, it works out for them. If they don't have any insurance, then, as I say in Jamaica, dog name them suffer. It's just the reality of what is happening here in the U.S. Healthcare here in the U.S. It's just a business. But yeah, I do what I can for the patient, what I can to, help as much as I possibly can. And then from there. But anyways, let me say, I say I'm going to go and see the patient and then come back. So you can always circle back. All right, you can circle back in 20 minutes. I'm not going to be there for that long. I'm going to see the patient 20 minutes and then I'm out. 20 minutes or less. And then I'm out. I'm out. All right. And I have my mask and my gloves. Yeah. And then, yeah, as I say, I missed my jacket this morning. I get too big, so my jacket not really fit my slim body again. You know them way there? Yeah. All right, let me run in and see the patient, because if I can't when it comes on to our patients, to take their sleep very, very serious. So this patient is in a rush because she's like, I need to go back to sleep. Yeah, so it's past her sleep time, so, I'm kind of intruding at this time. Alright. I'm just trying to do a dictation on this. Hi. I was just doing a dictation here. Alright. So I am gonna go see my other patient. Alright, so this patient needs some narcotics, but there's some problems with the system that we use to send controlled substance, and so I am not able to send controlled substance for him. And so I told him. So we'll see how long it takes before they fix that problem. I've been trying to send a prescription since Friday for a patient. Sure, phone freeze up. I've been trying to send a controlled substance, a prescription for a patient since Friday. Okay, my phone is frozen. Phone is like non-responsive. And I need to move, but I don't know where I'm going. Okay. All right. So this one is 7 minutes away. Then from there. Make a full turn and then head back home. Hi, morning. How are you doing? Or good afternoon, I should say. No, it's still morning because it's 11:43. Where are you joining in from, if you don't mind? I know you probably just run off just like everybody else. Oh, Lord, where are you joining in from? Lord. Anyways, let me continue. So, all right, so I'm going to see this patient. He is on hospice as well. No, he's not on hospice. So he's 93 years old. By the looks of, things, he could have gone on hospice, but his vitals are pretty good. I think it's just his age that is, causing him to be a little feeble looking. But yeah, he's he's not somebody that is like, very sticky, as we normally would have said. No, labs are pretty unremarkable. All right. It seems like it's not moving. Ouch. Let me show you. We're in Dallas. I'm passing through. So, and if you can see, yeah, and I'm in some place in Dallas, just in case I don't know where you're from. So, yeah. At some place in Dallas there. I wonder how politics in Jamaica are going today. Who leading? Not even checking. Yeah, because I'm not really interested in the politics right about now. Anybody that is doing a really good job, they can go in for as far as I'm concerned. That's where my headspace is at. I'm not loyal to any political party. Yeah. So my family is loyal to one. Nah. That was back in the days when you just jump onto anything that people say. They say, okay, then you're a JLP or a PNP. You just work with it because the entire community is with it. It's not like that for me. Alright, then the mentality there has been long gone for a lot of persons nowadays. So whoever is getting the job done, we keep them in or we vote them in. Alright, so there's this train track in Dallas that sometimes I'm passing and the train pulls up beside me and stops at the stoplight as well. The first time I saw it, I was like just laughing, come here and say, after I've never seen something here before. No, sir. So the little train, it's not even a train. I want to say a train. Oh, see there. I can't take it off, but it has how much cabins? 4 cabins or 2? It's actually 2, but it kind of looks like 4. That's like four cabins, two to 4 cabins. But the train stop at the stoplight with me. I said, no, sir. When the green light go off, the train go off as well. It's just so funny. It's just so funny. Alright. So that one runs through the heart or through Dallas itself. Here's the food and nice thing. Nice place to come and have lunch. There's a lot of trees, parking spots. Alright. So rotted. I never see the policeman on the bike. It's a good thing I'm driving the speed limit. The man have him gone so. Yeah, check him. No, sir. Excuse my language. No, sir. The policemen are on their bike, and me is here, just cruising. It's a good thing I'm driving the speed limit. Just me I take a $300 ticket right about now. Because I got a $300 ticket once now. It was $299.99. Yeah. $299.99. I was driving, I think I was going probably like 60 in a 35 or something like that zone. Yeah. And I never realized that there was a police vehicle in the side. And like there's this is the corner, the police vehicle was there, and I never realized. And so, oh Lord, sorry, lady, sorry. And I never realized. And then the police just turn on him lights, turn on him flasher. And there it goes. I had to stop because I'm alone up on the road. Me alone on the road. So if I had continued driving, it would seem like, him chasing me down. Yeah. So I stopped. Man said, where are you rushing to? I'm like, work? It's like, work? He said, where are you working? I said, I'm working in Nacogdoches. He's like, Nacogdoches. He's like, that's 4 hours away. I say, yeah, that's why I'm in a bit of a rush. It's like, you're not supposed to be speeding. This is like a 35 zone. You're going at 60. I'm like, is that so? It's like, yep. Anyways, I said, anyways, boss, because it kind of made me even later. So I said, so I'm going to get a ticket. And him say, yep. I said, okay. Write my tickets. But he never tell me how much it was going to cost. They don't really know. But I thought he would have had a rough, estimate as to how much I'm going to have to be paying. I said, no, you're going to have to call the town hall or something like that, city hall or the court. You have to call the court. There's more police over there, so I don't know what I'm going to look for. Anyways, he said that I'm going to have to call the court to find out how much I'm going to have to pay. I said, okay, no problem. When I go to the court, people them say I think it was $293 something because there was a $3 because I was using my card. There was gonna be a $3 fee. Can I turn here? There was gonna be a $3 fee that is attached to that. So some comes to $299.99. I said, no, sir. First ticket. So my friend could get my first ticket. But that wasn't my first encounter though with the police, because I was going to gym one morning, early in the morning, 5:30, driving out, feeling like, the road is yours because it's empty. And I only see this police on a bike and ride me down. But as I say, you can't ride and you can't be driving and thinking that, it's not you. You see them running down. Because then you're going to hear that it's a chase. You understand? When really and truly, probably never really see them even though them light, it's very bright. But, yes, I pulled over. The man says, do you know how fast you were going? I said, no, I thought I was going probably like 50 or something. Because the speed limit is like 45. It's like you were going 50. I said, 50? But he asked me for my license. But me never realized that whenever I drive my car, we have my body in it. Oh, that's not okay. So. And the gentleman said, can I have your license, please? License and registration. We don't have nothing. So the man said, I'm going to have to give you a ticket. No, the person said, I'm going to give me a ticket, and then he said, I'm going to give me a warning. All right, boss, not a problem. So I had to show up to the court again in 24 hours with my ID, my driver's license, and everything. So it don't go on my record. So I said, okay, no problem. And then from then, I was just driving like a decent citizen. The speed limit to 35. But sometimes you're driving 35 and the speed limit is like it's just so slow, You're driving, it's like very, very slow, 35, and there is no cars and a one long straight road, and sometimes your foot just feel a little bit heavier on the gas. So I try to drive within, the required speed limit. Yeah. Anyways, hello. Can you say where you're from? Just say hi or something, no man. Sure. Just say hello. Remember to join me on TikTok, alright? If you're a TikToker. I'm on TikTok at ThinkNursing. So you can come over there and say hello as well. Unbroken, it's you. How are you doing? It's been a long time I haven't seen that name on my live. But then again, I haven't been doing much live of like since a couple months now. Yeah, I just kind of restarted that the other day with my live. Yeah, I've been spending a lot of time on TikTok because TikTok is a little bit easier to use. So I've been doing that a little bit more because of my time itself. Sometimes I just don't have the time to do all of this thing on YouTube. But I'm kind of getting back into the habit of doing my live, as you can see. You know, I've been doing a few. I've been doing my live in the mornings at 5:30. What did I do the last time? I'm sorry. I'm so sorry. What did I do? Hmm? So I'm doing my come on I do my workout videos in the mornings. I'm trying to live stream them because it's a little bit more of a motivation at that time as well. I get more motivation when I do that. So I'm doing my live streams in the mornings at 5:30, and then let me turn the car because I'm going on my foot. All right, and then I try to go live at 7 o'clock in the evening on TikTok, and I'm gonna do it on. I started doing it on YouTube as well. So I try to do the live on both platforms at the same time, and then from there. So I'm trying to do 7 o'clock in the evening, 7:30 thereabouts. Yeah, and then from there on Thursdays we do. Oh, then the lighter, the clearer kill, you know. On Thursdays we do NCLEX questions. So just in case anybody is interested in doing NCLEX, then they can show up. But we actually have like good, sit down and chat, talk about nursing. Oh, got some need gas. I like pump gas, no, I like it. Yeah, but I asked you out in Dallas and you didn't respond. You asked me out in Dallas? No, you know, so me a married woman though. No. Yes. Unfortunately. All right. I'm off the market. Yeah. Mhm. But yeah, so we do live at that time. I'm gonna swear you me already did say what it. I'm sorry. I probably remember he won't. No man, it's okay. It's okay. As we say, I'm off the market. Yeah, understand? Off the market a long time now. For me, I had on my knee. I joke me I make. But I've been off the market for a long time, years now. Officially almost a decade. And yeah, so I do the live during the week, so you can always join me. But that doesn't mean you show up on my live, Show up on my live and ask the questions. You understand? Ask questions and be a part of my platform. Well, you're here today, so continue to be a part of my platform. All right. Don't let that drive you away from my content. All right. So yeah. But I do the live and he comes home ahead. You're too funny for me. Okay. So I do the live at 7:30, and then from there. But definitely show up. It's always pretty interesting. I do. If you realize there's some lives that are very long, those are the lives that are from TikTok as well as some of them are streamed on YouTube as well. So they are very very long because we sit down and talk for like 2 hours, 3 hours. And it's very fun. It's very fun. I've met some really nice persons on TikTok. TikTok is not my favorite, but I've met some really good friends on TikTok, and they feel like family. The people over there feels like family. So do come over there as well, and you can find people to talk to. And if you're into, if you're looking for someone, if you're looking for anyone. There's so many candidates over there. A lot of candidates on YouTube too, but then you can't get a chance to see them face to face, and the person can see you as well. So things like that is over by TikTok. Over there, said they. So I had a gentleman the other day who was looking for a partner. He's a pastor and he wants a female. He wants a wife. He thinks I'm on the market too. I'm telling him, no, I'm not on the market. You understand? So he was kind of just telling us a little bit about himself and what he's looking for in a woman. So definitely, there's so many things that are going on over that side. All right. So how has your day been unbroken? Oh, you know what? Let me go and see this patient before them drive out because the patient doesn't speak English. And let me see if it's the son. The patient doesn't speak English, so I want to make sure. Oh, I don't know them. Make sure I sing there to see them before. All right, let me go on to my last patient and then I'll come back. Then I'll be driving home. Hold on 1 minute. All right, so yeah, the patient is over there. So I'm going to run in and see them before. Yeah, and then I'll be driving home. Then you guys can keep my company. Oh, no, gone. Unbroken left. All right. I think he'll probably come back. Yeah. I guess I'm probably going to say break him heart again. Mm-mm. All right. So let me go down there. All right. So I'm going to go down to that patient, and then from there, I'll be back. All right. I'll be back. And then I'll see you guys. Let me clean off this. That looks up there. I'm going to see a patient and then come back. All right. All right. Sorry about that. The phone was too hot. So it shut off. All right, let me see if I can find my way home. I'm done a little early today, so that is good. So let me try and do that. So home map. Hi, how are you doing? So I am not taking any toll or anything. That's going to be a 47 minutes drive. There's a car coming. Jesse Delcy. Feel for something nice. Probably like a patty or something. But where to get a patty right now? Probably go to Costco. That's what I feel to eat. All right. It's after 12. I don't want to play any music because I don't want it to be copyright. Kid. Temperature is 85 degrees. It is hot. It is hot right now. All right. So I'm gonna do this. Oh, I need gas. There's Shell gas station here. All right. This one looks new. Oh, that's in Jamaica, brand new. So I'm gonna go over there and get some gas, and then sometimes I wonder if my eyelash them just too long. Always I mess up my glasses, and them not artificial, you know. Them not artificial, so I really understand how it's always I mess up my glasses. Mm. So I need to get my glasses changed, though. I need to get my eyes tested. Time for that. All right. All right. I'm gonna get some gas in this car. Pulling up at the Shell gas station. Where's the money to see the people them? And then I'm gonna head on the road afterwards. A piece of something nice. Eat a nice chicken sandwich from KFC in Jamaica. Barbecue one or a spicy zinger combo with cheese and tomato, fresh tomato, green, not green, green lettuce and some ripe tomato. Get this tongue because I only have one stroke. Hi, hola. I'll be back. Uh, 129. Alrighty, that's going on. I remember the first time I was pumping gas in the States here. I never know what to do, Didn't know what to do. I had to come onto YouTube to get that information. Clueless. Driving a car and don't know how to pump gas, put it in there, don't know how to fill up the tank. So, not until your tank running low, you figure it out. Yeah, and that was it for me. I was almost, the light come on the car, and I started panicking and trying to figure out how am I going to get the gas in this thing. And that's why I went on YouTube and tried to find out how do you pump gas in your car. That's how bad it is, or was at the time. Near hot. And I'm having a Nature Valley fruit or nut. Trying to say that I'm eating healthy. Yeah. Okay. Give me a minute. Alrighty. Let's go. Let's grow. Charge up this thing. Having a bit of a headache because outside warm. Yeah, I think that's it. Because outside is hot. supposed to be hungry because I ate bread and egg this morning. Hi, hi, hi. How are you guys doing? One for the people in pump. Welcome, welcome. Work is almost finished for today. Alright, going home to finish my notes. How are you guys doing? Alright. So that cost me $37. Yeah. Um. So I'm not taking the toll. So that's gonna be good. There's a lot of traffic on this road. Let's see if I can put the phone up so you can see. I'm gonna show you a glimpse of the traffic that I'll be up against right now. Some kind of. Alright, let me see. Uh-oh. Orientation. Oh, I don't know. I guess I have to go change the orientation. I don't know if do that. Alright. Didn't even realize that my speaker was off. Not speaker. My microphone was muted. Sorry. I didn't realize it was muted a while ago. Muted is because I was doing notes. I remember to unmute it. Yeah. I'm having a bit of a headache. I need some sleep. I haven't been getting much of that. I'm working on it. Still feels like I'm not getting enough sleep. Hi, how are you doing? Hola, hola, welcome. What would you try to do? No, I'm going to the room video. Oh, my word. Oh, two persons seem like they're racing. Like the other day, I saw somebody go under, Jesus. one of those old-time vehicles. Alright, do you see my? Okay, thank you. Okay, go on. What kind of car is that? I don't even know what it is. Some of those old school kind of vehicles. I think I can see the name on it. Oh, it's a Lincoln. Okay. Last time I saw some vehicles like these were when I was going through, what was it again? Oh my word. Before going into Mississippi. Yes. And all of them had on some big rims and wheels that don't even match the car. What's that place called again? I remember the place. I'm going down, boss. But there were so many of those old school cars over there that were on sale as well. Not Connecticut. Why am I thinking about Connecticut? Not Oklahoma. Yeah, somewhere close to Texas here. Yeah, they had a lot of them on sale. And all of them had on some big rims, the big wheels. And these are like sedan I'm talking, We're not talking about no SUVs. Yeah. But in Mississippi area, that's like section of the world. Yeah, they have a lot of them down there. But they repairs on this section of the road. HOC lane. But how are you doing though? I see you hanging out for a little bit. Hi, how are you? And if you haven't followed me, I said follow me on TikTok at ThinkNursing. Alright, so share short form content over there. Pretty okay. So you can check out that page as well. Yeah. So I'm actually heading home. Go to the park or the library or the park. It's kind of cool. And finish up these notes. No, I'm gonna go to the library. What time is it? 1 o'clock? No, I'll go to the park because it's closest and just finish up some notes. And then go to my son for 3 o'clock. Yeah. So they're fixing something on the HOV line. Why am I saying line? Lane. It's because they have so much traffic. Because they have a lot of cars using that lane. Oh Lord, I'm feeling tired. I'm wondering if it's because I wake up so early this morning. I woke up and I did my, well, it was 20 minutes. I thought it was going to be a 30 minutes workout. Did a ride this morning on the bike. And now I'm feeling tired. Like, tired. Oh, Lord. That's probably because I'm driving. I feel like this. If I was working, I wouldn't feel, yeah, I don't feel like a normal person. Oh, it's just that, I would feel like a normal person. But 12:54 p.m. driving, you get me hungry. Well, I'm not really that hungry because I had that bar. But yeah, I just need to drink some water. Yeah. I'll probably just buy some stuff and buy some patty. Maybe some beef patty. You know what? Let me hold my head straight because I did say that I was gonna adjust my diet a little bit. So I'm gonna leave all that already. Oh, I'm gonna eat some boiled dumpling. Gonna have some boiled dumpling. Probably Irish. Yesterday I had soup and it was kinda good. Yeah. My mother don't know to cook Jamaican food in America. So the soup is alright, but never have that taste that me I look for. Yeah. Never cook it properly. Something was missing. I don't know if she ever put enough cock soup in there. Because they have to kind of put a lot of cock soup in there, you know. The chicken noodle soup. Yeah, you have to put that powder in it for it to actually taste good. Or else you just put one pack in there, you're not going to give it no taste, it's not going to taste good. So I don't know if she just put one in there and that was it. But the soup never tastes like a Jamaican soup. We just eat it so. And Lord, I'm not complaining and I'm not ungrateful. My word, my sentence, I was hoping to have some creamy chicken soup. You know, chicken foot soup, chicken paw. Soup. And the soup, yes, because I smell the cock soup in there, I'm going to really taste it. I wonder if she'll watch this here, because if she'll watch it, she'll go cut, she'll go and put no more soup. Oh, my word, man. I couldn't taste the cock soup any at all. I could see a little remnants of it. And yeah, the soup was okay. So, yeah. She not catch the pot right at all. At all. It used to take time, you know. But most of the seasoning that I use, like I use a lot of Jamaican seasoning. Well, not necessarily Jamaican seasoning, but seasonings I've been using in Jamaica. You understand? So nothing really changed except the meat. Nothing really changed except the meat, you know. Because at one point, I never know that chicken could cook in like 30 minutes, 15 minutes to go finish with chicken. And you cook your chicken, and you're ready to eat the chicken in 15 minutes. I never know about chicken, you know, being that tender that you could actually cook it in 15, 20 minutes and be enjoying it then. Because the Jamaican cook until the kingdom come, 1 hour the pot on fire cook. Okay, put the pot on fire, and before you know it, chicken is ready. Cheers, not to mention the beef. Because when we cook beef, my beef will cook 2 hours. When we cook it, I don't know. I want it soft. But then, you go to the store and you see, not the store, you go to the restaurant and You hear medium, what do you call it? Medium rare and what? Well done. Well, one of them call it, yeah, well charred up. You know, have to tolerate it a bit. Or you have to get it with a little bit of blood in there. I mean, I don't know something. I'm not accustomed to it, so I could have been well cooked. Don't know if we're doing it correctly, but that's how I know when we cook it, that's how it goes. The only thing that probably don't take that long to cook is like your fish. Yeah. Yeah. It don't take that long to cook with your fish. Because by the time you cover the pot, the eyes them pull out. You know, so it's ready. When this person come from the tail. Ah. So that's just it. But yeah. But I hope your day is going well. You who is hanging on, thank you so much for keeping me company. All right. Thank you so much for keeping me company. Probably a smile now. Yeah. Because I recognize you there. I recognize you were here for a long time, you know. But to call me now, dear father. Yeah, man. Hold on 1 minute. Just grabbing my earpiece. Hello? What's wrong? I'm on a live, you know. Yeah, it's 1 o'clock when they're on busy road that come down. Alright. Alright. So, yeah. So I see you. Let me go to this side. Alright. Okay. So yeah, I see you, and I want to say thank you for tuning in. Alright. Should I ask for them cook home, you know? Because I'm hungry. Mm. Hungry. We don't just say you like would I eat anonymous calf right now? Is that saying go? Yeah. Kind of picky. Not that hungry, but yeah, want something nice. You know when I eat, I would eat yeah, but I still eat the patty, you know. When I eat the patty from up at Devon House in Jamaica, one of those patty, them fancy twine up, like, you know, whatever you want to call it. The patty them from up at Devon House with the curry. One of those curry patty. Yeah. Can just see the steam come outside. Yeah. Smell it right now. I probably eat a piece of, you know, Roman Raisin cheesecake. Yeah, the Roman Raisin cheesecake tastes good, you know. So make sure if you go to Jamaica, you try out. Write it down. Devon House ice cream. You're going to go to that place. It's in Halfway Tree. Yeah. So you're gonna go over there and you're gonna order patty. You can get any one of them chicken, beef. They're supposed to have goat, as in mutton. They have what else they have up there? I don't know. But try those and try their Roman raisin cheesecake. That's good. Yeah. You won't get drunk from that. Alright? And you're not gonna get addicted to any alcohol or anything from it. But it tastes good. You can taste the rum in it. It tastes actually nice. All right, so definitely check that out when I go there. But that's what I would eat right about now. Probably eat 40 potatoes or three, because the potatoes are not so big, small, unless them change the size. Yeah, so that's what I would eat right now. Or probably a food from down Bangkok Mall in Mandeville. Uh, Barbie fry or something. Anyways. Hi, how are you doing? Yeah, so that's what I would have right now. And I'll probably drink one of those juice from Island Grill. Yeah, Island Grill have this juice that tastes really nice. It's like a guava mix up, yeah. I'll drink one of those. That's what I feel for. Probably some barbecue hot wings too to go on with it. Yeah. Yeah. Um that's from Jamaica. Oh Lord, so sit down here, sit down my sing for Jamaican food. Why, dear Father, why? No, I'm not pregnant. Alright? I'm not craving anything. I just feel for some real Jamaican stuff. Real Jamaican food. That's all. Yeah. I cook Jamaican food at home. But as I say, some days it seems like my mother not catch the pot right. You understand? She missing the spice. Well, then again, me I complain about the spice. But I think police is here. She missing the spice sometimes at the pot. Then I really give that Jamaican, vibes again. I just become can't find real yam as well. Yam and green banana kind of stuff there. Saltfish the other day, we go look for saltfish, gonna find a saltfish. I like the saltfish with the bone, or codfish with the bone, yeah. I like codfish with the bone. And aki them get so expensive. Tinaki, but me never did I expect that I would be eating in America. It gets so expensive. And by the time you look, the one thing aki done, you share the food and the one thing aki finish. I love aki. I love aki. Like I'll eat aki every single day. Yeah, I love aki and saltfish. And that's one time that me really love when there's a lot of black pepper. I'm not really a black pepper kind of person, but I love when my aki have black pepper on it, and my egg have black pepper on it. But I'm not a black pepper person. But if the aki don't have black pepper on it, it's like the aki not really cook properly, not well done. It has to have some amount of black pepper. You can taste it, and it's just like the egg. Kind of gives it a different flavor. Yeah. So I do cook a lot of Jamaican food. Ask me about any American food. I don't really know about them. The American food only give you a bunch of nausea. Like you're pregnant. Just make you very, very nauseous. And yeah, give you upset stomach. Like you can't eat. And then where they have burp every second and like you can't smell everything that you just eat. And it's not like you overeat or you eat too much food. They can't overeat my American food. That one food me realize, like I eat a lot, and that one food me realize I can't overeat on because the food just blow you up. Yeah, it make you feel so full. I don't like it, man. So yeah, and if the food not too salty, just too oily. I'm not complaining because I talk, I tell you how it is. So I'll stick with the McDonald's fries, and I'll stick to the Chick-fil-A chicken. Because Chick-fil-A fries not even taste good. But every Friday I gone there with my son, because that's the only thing he eats. But Chick-fil-A fries don't taste good. Chick-fil-A fries, they have to buy fries in the McDonald's. They can't even get nuggets from McDonald's, so the nuggets come out cool. They have to get fries from McDonald's and the chicken from over Chick-fil-A to make a meal. Lord of His mercy. What's up? My savior. But yeah, you know, that's American living for some. For some people. That's what I understand. The people that can't cook. How not do? How is it that things are working out for for those folks? Because I just know that a lot of the foods up here, a lot of the foods that's gonna get in, as they too salty sometimes, too greasy. You feel so full, so nauseous. Like I don't know. I understand, but yeah, American living. You spend $1 million on a decent food and you come out looking back on the same place, in front of you. You not take on anything off of the plate, you don't know off of the plate. You don't know off of the plate, Yeah, look on the same food, yeah, give them back to the folks you order the food from. And you spend the money. You go there for just long and look out at space and look at the colors of your plate. And the decorations and everything is good. The place is really nice. And I guess that's how what you pay for. For some persons or for me, that's how I feel. I just go there for you know, the setting, the ambience itself. And just go out with friends just because of. Like the other day I went and I got this drink. And I don't know if it was supposed to be like that. But the drink, when you have your lime, and your lime just have too much lime in it, and you can't feel it, you can't taste it in the juice. But then, when I was growing up, we used to have a lime tree, and when we're making lime juice, if you have too much lime in it, you don't ever want to drink it. I mean, up here I spend $40, because I think a $40 it end up coming up to like $40 for one little glass of lemonade. With a little piece of pine cut to the side, to make it look cute, and then little coloring in there. And then you hear the people say $40 and call it a name. Like, no, sir. Me can't manage at all. Cannot. I cannot do it. You understand? I cannot do it. Just a lot. I cannot do it. But, money I have to make. And you have persons out there who's gonna spend it, come up with a name, come up with a fancy name, and then the same sugar and water, you just put a little umbrella on the side with a piece of lemon or a piece of orange. Alright, I'm going for you, boss. That's my turn. And then we call it a name, and we charge $1 million for that juice. Charge $1 million for that juice. Yeah, that's a good thing about America. Everybody can actually make a money up here. You just come up with your idea and you just label it. You go there and you sell it. You don't have to watch anybody else, price. You just sell it at whatever you want to sell it because there's one person that is gonna support you. Yeah, and there's one person that is gonna support you. So there's so much opportunity here. I'm trying to figure out what is it that I can do. Oh, what are they? Labeled up. Is your life easy for Americans? Lord of His mercy, I think they're painting the grass. When they paint the grass, they have this thing that it looks like a remote control. Yeah, I'm at the park. I'm going to the park. My park. Feel like I'm my park, because this is where I come and hang out and do my notes. It's relaxing. Yeah, it's relaxing. There's not much traffic. Can sit down and look at the lake. Yeah, things like that. So I'll just do my notes and then call it a day. But yeah, it's too hot to camp over here though. Too hot. But when it's cool and nice, you can come over here and do your thing. This is where I come and do sometimes my jump rope. Yeah, do my jump rope sometimes over here. have a little kiddies park and everything over this side as well. And there's a school, so I'll usually go to the section close to the school because usually they'll have one and two little police over that side. They know me already dark, so they will keep a close eye on me. Alright. This is where I'm gonna be parking. Woo. Yeah. Oh Lord. Well, thank you so much for tuning in. Can you just say hi down below? You can't say hi down below. Say hi now. Say hi, man. Just say something. But don't say I'm out. Alright? But say something. Alright, it's okay. I know you're probably not gonna say anything. Let's keep it that way so we can just continue. So we can just continue talking. You understand? Because I don't want to be a case where me know who you be and then no, you change the vibe. You know them way there? Because what if you're one of my relative and you already know my history, my story? You know, make no sense to talk about my story again. You understand? So it's not going to be fun again talking, telling the story. So I'm going to keep it at you're a stranger. Alright? You're a stranger. Yeah. And that's it. Because it could be my mother too, you know. Could be my mother on the live here watching and I may talk about how our soup never tasted good yesterday. Lord have his mercy. The year when I go home, so I have to go make my own food. No, sir. Go do some fasting. Alright. Yeah. So that's about it. I'll turn on TikTok and see if anybody from TikTok is over there. Yeah. There's a different vibes over TikTok, you know. There's a different vibes over TikTok. So definitely follow me on TikTok as well, please. And thank you. All right. All right. Let me go on to TikTok for 30 minutes. And then from there, we'll hear what the folks are saying. All right. Let's hear what the folks are saying. I'm going to tell them to tap the screen, you know. Let me tell them to tap the screen, yeah, because, you know, when you tap the screen, it actually sends your content out, you know, that way. And it doesn't hurt to tap the screen. Like, me always tap the screen. I don't need to know you have to tap the screen. As long as I don't tap it and break my own phone, you know, my phone screen, then I'm good. But I tap up the people them live, you understand? So I don't know why it's so hard for persons to go on another live and not tap the screen. You know them way there? Yeah, tap the screen. The only thing I'm not going to say is send on the roses and the lemon, the lemon and the lime and all them stuff there. No. I just wanna. Oh God. Okay. This not gonna work. All right. Let me try to put this. Where can I put this one? I got this on TikTok. All right. So I'm gonna try to go on live. I wanted to put it close by so the people can. All right. Let me go on live with TikTok as well. But as I say, I'm only spending about 30 minutes because I'm coming on live tomorrow later on. Coming on live later on to discuss nursing content. So, yeah, I need somewhere to put this. And then I'm gonna start to try to schedule, you know, the live a little bit better. I'm working on that. I'm working on it. I might not seem that busy today, but usually I'm busy. All right, smell it, walk on, hola. See, the people them just turn up. Them just show up on TikTok, you know. Them just show up. Yeah. All right. Let me go ahead and send out the live so people can actually say hello to me. Yeah. Let me just send it out to the folks here. And then we'll see who shows up. And then from there, yeah. Hi, how are you doing? I haven't forgotten you though, you know. I still know you're there. Alright? I know you're there. Well, let me just greet my folks over here as well. Alright? Let's see if I can put this somewhere. I need to put this somewhere so I can actually. Ricky, hello. Simone Foster. Where you gone? Uh-oh. So how are you guys doing? How's your day been? I see, well, how's your day been? I think I only staying on for 30 minutes, you know. I was on another live and I was like, let me just jump on and see if I can say hello to my folks here. Yeah. I want you guys to join me at 7 tonight, 7:30. Let's put it for 7:30. 7:30 for the live. Because tonight is what, Wednesday night? And then tomorrow we'll do NCLEX question again. Probably do for probably like 3 hours. Or tomorrow Thursday night, and I'm working in the day because I never work this Monday. So I say I'm working 3 days. So, yeah. So I say I'm gonna work 3 days, and then so that means I'm not gonna get Thursday off. So yeah. Black River Youth, Wagwan, Hola, Ty, welcome, April, welcome, welcome, welcome. What's on the menu for lunch? Krishna, Drew Thompson, how are you? Oh, mm. Run Gray Ian, and I'm here, 120. How are you doing, Drew? Okay, I guess that means you're doing good. Honeyberry, how are you? I'm gonna try and see if I can do some notes. In the meantime, where I go home. Oh Lord. Yeah, probably need to come out of the car and go stretch. You know them way there? Yeah. I've been driving for how much hours now? A few hours. Started driving from probably like 9 o'clock. Been stopping, you know, in between patients. And so I went and visited how many patients? Six, 5 patients I visited. Yeah. And then from there I was like, yeah, it's the end of the day. So be honest. And then probably the yawn is probably because of, you know, the fact that I woke up so early this morning as well. I'll put on some lip gloss before I understand that we need to put on lip gloss. Oh Lord. Mhm. Yeah. So this is very good. I got this in Maine when I was there, so just in case. Burt's Bees. Alright. I used to put it on my ID and hook it up here so that way when I'm, working. But in terms of with the weather, if the time is very cold, it's very, very good for, your lips. Hi, Kiara, Rita, William, Greg Henry, Rosemary Wisdom. Thank you for liking up the live. Sam Reed, welcome. All right, Roslyn Filosh. So how is your day going? How is your day going? Robert R. Welcome, welcome. Yeah. I'm so sorry. You know that thing catch you though, right? Yeah. So I'm gonna do those little notes that I have there. I think I have about 5 from how much I have remaining. I have 4 from yesterday, and then I have 3 for today to complete. Sam Reed, how are you doing? How are you doing? How is work going? Are you on or off? Yeah, Madame Solon, how are you? Rita Bliss, what do you think about international nurse starting at a nursing home? Mm, Deborah K. Well, I don't really regarding the nursing home, I think probably you'll do a lot of management, I'm thinking. You're not gonna really have that much nurses like RN on your shift. Because they have like a lot of LPNs working there, or what else they call them. Yeah, so it depends on how much years experience you have, and are you looking to get sponsorship, or I don't. Well, no, that's the wrong question. That's the wrong question. Yeah, it depends on the years of experience and your strengths, as far as I'm concerned. I think if you have, if you have the skills, especially when it comes on to management, I think probably that would be an area that you can actually start out in. Um, but I don't think you're gonna have a lot of support there, like in the hospital setting. So that's just what I'm thinking. So usually nursing home, people don't really want to go to nursing home go work. You understand? A lot of persons don't really want to go to nursing home and work because the patient load is just too much. It's just too much for one nurse or 2 nurses. So you have to kind of think about that as well. But then if that's where you're getting the job, then I guess. But there's so many hospitals that are hiring right now. So if you're already here, I would think that you should be all set to apply to regular hospitals to get, a job as a RN. Sponsorship needed. Oh, so if you're gonna be getting the sponsorship through that company, then fine. Fine with that. If they're gonna be sponsoring you, then probably that's something you can say, okay, then you're gonna get your orientation and everything, but and probably some really good training. So I'm just thinking, so if you're getting the sponsorship there, then anywhere it's coming from, you just take it and work with it as long as it's still a part of your scope and you're comfortable with certain things. How many years of nursing experience do you have, if you don't mind me asking? You just have to know your strengths and your weaknesses, because a lot of times people will tell you that don't go in. They can't. Oh, they can't wait to go. Don't want to go in the nursing homes. Rosemary Wisdom. I'm in 4th year of nursing school. Can't wait to finish. Okay, congratulations, Rosemary. I remember those days. Just sitting down waiting for school to be finished. What school are you at now? Yeah, I remember those days, 4th year, prepping for RENR and the practical exam and all those things. Yeah, you're just so excited to finish up. Whew. Uh, okay. Oh, remember to tap the screen, folks. And remember to do your, what am I say again? Oh, Jesus. Get your heart me. Yeah, claim up on art me. Them stuff there, yeah. Make sure you go ahead and get your art me started out. That thing there where you always see on the people in my head, yes, the heart me. Remember to go ahead and do those. Engage with the content. Remember to share the page or the live and like up the live. Yeah, I was told that I need to be talking a little bit about those. All right. So, no know when people are now TikTok, because we just come and talk. But definitely go ahead and share up the live and tap the screen. Tap the screen. Tap the screen. All right. Brownstone College. Okay. Okay. Nice. So just make sure, when you're finished, you get your experience and everything. And I'm saying that, we're recruiting people to overseas here, but I don't know what your plans are afterwards. Just make sure you're getting your experience, get your skills and everything up and running. Yeah. And then from there. All right. Are you planning on, coming overseas, though, Rosemary? Talk the truth. Talk truth. Edit. Ready? Welcome. How are you doing? Dorrit Carthy, D, Bell 46, Joseph Williams, Charlene. How are you guys doing? Thank you for tuning in. Okay. Yeah, so just definitely make sure that you go ahead and get your experience in one of those hospitals. All right, get your experience in one of those hospitals. Get your skills up and running. If you're shy, get out of that comfort zone and start, speak up. Get your skills them up, and what else? Yeah, just be the best nurse that you can be in the meantime, and that's it. Hola D, how are you doing? Okay, you say I'm blessed. Okay, nice. So definitely, if you haven't subscribed yet, Rosemary and all the others, remember to go ahead and subscribe to my YT page at ThinkNursing. All right, go over there and subscribe to my page, and you can always leave any comments or inbox me or whatever it is that you prefer with your questions. But Rosemary, I do have a lot of videos over that side regarding transitioning that I know you will benefit from when you make that decision or you start the process. So definitely go over there and bring all your friends them. Yeah, bring your friends them over that side as well for them to subscribe to my page and be a part of the community. All right. No, D, I'm not in Jamaica. No, I'm not in Jamaica right now. I'm in Texas. Penny Led, hola. Kids for me, welcome. Richard. Are you in Jamaica now, D? Shin, hola, welcome. Who is on YT here? Hi. Oh, let me see. You have a flash goal. Alright. So what is it? Achieve this goal when 3 gifters send heart me to your life. Pin it to okay. So TikTok is saying, so go ahead and send me a heart me. Send your heart me to my live. You understand? So 3 gifters, send a heart me to this live whenever you can. All right. But yeah, I'm not in Jamaica right now. Oh, you're in Florida. Okay, nice. Yeah. And Sam, thank you for liking up the live. Sam is in Jamaica. Yeah, but yeah, I'm done with work, but I'm just trying to burn some time. I said I was gonna try to finish up my notes, but sometimes the brain's just tired. I'm actually just feeling tired. I think probably because of all this exercise. All this exercise, waking up early in the morning is causing it, and then I'm not going to bed early as well, so that's the other problem. I'm working on it though. Working on it. User 1505 and a ton of numbers. Hola, thank you so much for liking up the live and for joining in. Alright. Mindful Medic. Hola. Dion Brown. Hola. And as I say, if you're new here, I'm a nurse. I'm a nurse. I originally was trained in Jamaica, and I was working in the hospitals in Jamaica. Well, in one of the hospitals in Jamaica. So I was working at Mandeville Regional Hospital. It's a public hospital. We call it secondary hospital. The same thing we call like level 2 trauma hospital here. So, we don't really have that much resources. We're always short staffed, and there's a bunch of different things that has been going on. And transition here in 2016. Then I completed my contract with that company, went back to school, and did my master's. I do house call as a nurse practitioner now. And as I say, some days I like it, some days I don't. It depends on what's going on out there. And I share general content regarding nursing. Nursing is a really good profession, and if you have a love for it, if it is something that you definitely want to do, I would encourage anybody to go ahead and, do it. There's so many opportunities with nursing that, is out there. So you can't go wrong with it. As I say, if you have a love for people, if you have a love for, just wanting to help people, then this is a great profession for you. My platform is about, me sharing my story. It's more for encouraging, it's more for motivation, inspiring people, education, all of those things there. And I want to do like a podcast where I talk with nurses, or I've started, but it's not really officially like a podcast, but we just chit chat. I want it to be a setting where it's just, we're just having fun, interacting, getting persons to know the nurses a little bit better, hear more about the day in the life of a nurse, not necessarily about the Stanley Cup and the FIGS uniform and all of those things, but hear real stories that nurses are going through, things like those. I'm talking with a few nurses regarding that. And I want to do more in terms of like community outreach programs and just giving back to the community. So I want to do my own foundation as well. So there's just a lot of things that I really want to do. As I say, giving back is something that I genuinely want to start up. I really want to do that, especially in my community back in Jamaica. All right, so that's what my page is all about. So, yeah, so if you see me here always like just talking, yes, I'm talking a lot about nursing, and how to improve on one and two things, help with, persons that are coming into the field of nursing, or persons who just have, an interest, not necessarily want to be a nurse, but just want to hear about real stories, because I definitely talk about those a lot on my page. So this is just a place that, we talk about the things, all right? Sam Reed is saying, how are immigrant nurses treated by our U.S. nurses in the hospital setting? At first, as I say, when you come here, you're gonna feel as though you're like an outcast, depending on the facility you're at. Honestly, after a while, I guess it's more because persons are learning your personality. They're trying to understand your culture, so you're gonna feel as though you don't really belong anywhere. Let's just say, and then after a while, depending on how the interaction is, then you might find out that one and two of them will accept you. And then from there, if they find out that, one and two accept, probably the entire department start kind of warm up to you a little bit. But you're going to realize that it's a bit different. It's not going to be like I guess depending on where you're from and your culture, you know, it's not gonna be like all teamwork. Teamwork is like sometimes you're literally gonna have to go over there and beg, and you know the young lady's not supposed to beg, but that's how you're gonna feel. You understand? You're gonna go over there feeling like, oh, you're asking them to come and take care of you, when really and truly it's not you. It's not you on the bed, you know, it's the patient. You understand? But the teamwork, you're not gonna really feel it initially. Sometimes you might find yourself feeling as though you're really drowning in the, you know, the patient load, and even though you're probably asking for help, sometimes you feel as though you're not getting it. So initially the support is not gonna be there. So that's why I encourage persons prior to coming over here. I know, yes, you know, you want to work on certain things. Make sure you're working on a time management. Work on, you know, advocating for your patients, speaking up. You understand? Work on your skills, because those are very, very valuable when you get here. Not only for the first part, but in the first part of you transitioning, you're going to realize that if you don't have those skills intact, yeah, man, you're going to be running into certain situations that you're probably going to start crying when you leave the department. So just work on those in the meantime, so that way whenever you get here, it's not going to be that bad. At least, you know, when it comes down to, you know, prioritization, you know how to do that, you know which patient to run to, you know, first, second, third, who can wait, them kind of things there. So even if you're not feeling the energy in the department, even if you're not getting that support that you need, at least with you having those things, you know, then definitely it will be a little bit better for you. Hope that answers your question. And probably if you're the yes nurse, if you're going to be the yes nurse, if you answer yes to everything, like if they say jump, or if they say go and do this, go and do that, and you run and do it every second, then probably like you, because some persons will just use you. You understand? So you have to know your limits. Miss Change Royal status, welcome. Earl Edwards, welcome. Yard Food, welcome. Yard Food 876. How kind of yard food you sell now? Yard food. Avia Miller, Maxfield. Alright. Suya Surreal. Suwe Surreal. Hola. Just a Girl, welcome. Nobody's Bay, 10, welcome. Riri Simone, 19, Wagwan. Alright. So how are you guys doing? John Enriquez. Okay, nice. Oh, you vote today, Ria? Riri, did you vote? Did you really put a X beside the bell? I'm doing good. I see you put up the orange there. I'm just assume now, say, you're the Jamaica or you're from Jamaica. Because today a politics day. You know them way there? Yeah. So I see a nice little orange up. So I wonder, or it's just a random color. Yeah, today is always ahead. Okay. I mean, I know if I was in Jamaica, you know, I don't know if I would probably put it beside the head though, you know. Honestly, I'm sorry. My family is you know, but I don't know. Thank you for the follow. I don't know if I would have put it beside the head. If you remember the head or the tail or the bell. Yeah. I don't know if I would have put it at the head. I don't know. Probably peer pressure. Probably peer pressure to say, yeah, put it beside the head. But then when you go around at the back, you know, you just do the bell. Because I think, you know, I'm not there and I'm not really following up on everything. I'm not following up on everything that is going on. So I'm just going off, like, you know, certain things that I'm seeing and I really like them. But I don't I don't really know the deeper part of everything else that is going on the floor in terms of looking out there. Yes. So like, as I say, I don't really know certain things. Like I know like the little surface, things that I've been seeing on the news and all over the past couple of years. I mean, I said, well, some of these things are good. So I was like, okay, then it would be only fair to do, the one thing and say, okay, give the person them another chance and see what they can do. So that was just it. But yeah, my family would probably say, no, you have to put it at the bell. You have to put it at the head. Yeah, you have to put it at the head because if you do anything else, then probably vex. Yeah. So, but I just hope everybody just do it for I don't know. I honestly don't know, but the people will go out and vote, and I guess the best person that come up with the best plan will eventually win, and that's it. And we just have to work with it, work with whatever plans both persons have put forward. That's just it. That's all I see it right about now. But I really want the health system to be better. So anybody that has a really good plan for the health system, and not only that, but even for the nurses them, the nurses them were migrated years ago and want to come back. I want them to have plans in place for those nurses. So what are the plans they have in place to get back some of these nurses that have migrated back into the country so we can actually give back, give back to our own people? Because I know a lot of persons would be interested in that. I know that I will be interested in that from like long time. You understand? Okay, nice. Are you over here or in Jamaica? So I would be like so interested in that because I always want to give back to my country. And if they have something that is gonna pay real good, New York, okay, nice. If they have something that is gonna pay real good to nurses when they get back there, and it's not only it's not really a special treatment, but you have persons who are like public health nurses here, they're nurse educators, nurse practitioner, them advance themselves and doing pretty decent over here. And some persons really want to go back. And they don't want to go back to bedside nursing. They don't want to go back to bedside nursing. What plans do they have for all of these advanced practitioners? Things like that. If they have really good plans in place in terms of compensation and everything, and it looks good, it doesn't have to be 100%, but at least if they have something, I'm sure there's a lot of persons who would be thinking about, going back to give back to them community. You understand? Give back to them the hospitals down there in terms of service. Because I know that, if I have relatives in Jamaica, I have a lot of relatives in Jamaica. Like who is at the hospital taking care of the people them? You understand? So I know that you have persons who are thinking along that line that are looking out for their own relative that them couldn't put in the barrel and bring with them to America, or the suitcase and bring with them to America when they were migrating. So I know that a lot of persons, they do get the opportunity to migrate and they're here, but they're still worried about all of their family members, their loved ones, who are still seeking health care at those institutions. And when you think about that, you have all of the trained nurses migrating. So who is left there? What is going to be happening to all the persons that are seeking, health care? It's just not going to be good for them. So I'm sure if they have plans in place, a lot of persons will go back down there because at least they know that if their family member comes in, and not only their family member, but at least, they will feel better with certain things that is being done in the institution. Island Girl, hola. Raymond Gauntlet, welcome. Prim Unstoppable, hola. Riri 876, the Jamaican flag, welcome. Yeah, so that's just it. Angie, how are you doing? I'm trying to understand all of these things. So it says Angie just got a #2 gifter badge. I really understand them stuff here. The other day, somebody told me that because they were asking me about how I interact on the live, and I was telling them that most of the time I'll just go around and just give out the roses, and I will do the heart me. So I said, do you do anything when you do the heart me? I said, no, I don't really do anything when I do the heart me. So I never know that the heart me has like a list of things that you're supposed to be doing. So all this time I'm on TikTok and I'm giving out the little donut and the little heart and the heart me. I never know that I am not even interacting any at all with, I just go over to the live and I'm like, okay then, I'll give you 5 roses, 10 roses because you're doing good. And I'll go ahead and do the heart me. Me never know say I wasn't doing anything on TikTok all this time. So I need to go and read on TikTok a little bit more. Get the TikTok handbook, the Bible for TikTok. Yeah, and understand it. So it work out in my favor in terms of getting more persons to come on my live, and even the tapping on the screen, like tap 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 tap, like that also helps with getting more persons to your live as well. So things like those. Just got in from work. Okay, okay. Where you working from, Angie? Where you from? Let me see if Angie wants to talk. Oh, she answer. Hello? Hello? Is it my phone or something not working? Or she not connected properly? Oh, you're in London. Okay, okay. That's nice. I'm not hearing you. I don't know if I never did something. So I'm not hearing you on the thing here. Patricia Mollet, welcome. Oh, yeah. Because usually I'll see the little, like, icon here for the microphone. I'm not seeing that on yours. So I don't know if you want to disconnect and try again. Or let me send you a link and you try to. Yeah, I don't know what's happening. Yeah, try to disconnect and then you can call back. You will call back and then you can do the invite again. Let me see if Just the Girl wants to talk. Um, Devon, welcome, welcome. Alright, I think I'm gonna end this live stream over on YT. I probably should have just let it stay. Not hurt. Jamaica, Jamaica, welcome. Probably is it 2 o'clock? 1:45. Hubert, wisdom, welcome. Jules, yeah. I'm good, Hubert. How are you doing? Do we have any update on the thing there? I'll probably look online and see. I'm doing good. I am doing good. How about you? And where are you joining in from? Nurse Cherise, welcome. Lane, Trying to do this application for school, not for me, for my son. I'm trying to switch him from a different school. And then there is this file that I need to download and then print it and sign it and upload it back to the website. It's annoying me. It's annoying. But yeah, I need to do that so I can send it out. Brooklyn, how are you? All right. It feels so good to see my PMP party. Oh, you're PNP. Okay, okay. So they won? What time now? Who win? Are they leading? Is that so? I'm going to try to go online and look it up. I'm not really into politics like that still, you know. Let me see. Not really into the politics like that, the politics. Yeah, so that's just it. Ella, how are you doing? Welcome, welcome, welcome. You're on the live. Let me see. Hello, hello.
What one girl?
My day here. How are you in Jamaica?
No, sir.
Oh, Lord. You good?
Girl, but listen, it's when I know being a clinical and all of them nights. Listen, I just love the vibes, yeah, so. But I know people who gone down, but.
Yeah, I see some people say them gone to Jamaica gone vote. So I say, no, sir. Really hardy. Huh?
You're nice, too.
Huh?
I said, I love your hair.
Oh, thank you. Thank you. I'm going to do it. Yeah.
Yeah, so I can help them to raise my friend, Colin.
Oh, my word. I didn't even put it on because of Jesus.
You can't tell it.
I never put it on because of that. I never put it on because of that.
You can't tell it because you never agreed
And then last time I have agreed. Oh, my word. And if I had known, probably I wouldn't have put it on at this time. I would. No, sir. I didn't even realize. But yeah. I find this new technician and she actually do nice nails, so it's alright then. But this is one of my favorite color and I realized she had it. So I said, no, what? We'll just get it on. No, but you know, I have nothing to do with politics. Oh my word, if you never say it. No, sir. No, sir, at all. Mother not even say anything to me. So mommy not even say anything to me. Say, oh, you put on, you know, PNP color. She never even say anything. Probably she just thinks to me and sell it. Yes. Yeah. Hi, Jackie. Hey, so how clinical's going? Oh, okay.
I'm starting tomorrow, but I didn't the pediatrician. I didn't do, you know, like, you went to Chamberlain, right?
No, dear. They do all then.
So, I didn't do like a pediatric rotation yet, so I'm doing that one now and then that's it.
Okay.
And then I have capstone.
Okay. So. You know something I don't know. I hear everybody talking about capstone. You know something I've done? Never done. Nope. I just study.
Because honestly, after this course is finished, because this is like one of the, like this is the last like core course, right? And then capstone. But I'm thinking with capstone, like it's not like clinicals in a sense. I don't know if you still have to go to the site, and I know that then we're going to, because we go to Chicago, at the end.
For what?
For like a revision for the, like. It's like a boot camp thing.
We don't do none of them day. I'm pass the same way. I keep on hearing a lot of persons talking about it. I hear a lot of persons talk about it, but I never did any. I just study and just do my thing. I'm not gonna spend any extra money to do any of those.
What I think you know like how here like after because when we were finished school in Jamaica, like when you're done and then you study and
you go study, you go do your exam.
Here, I think they have like where they do like I think it's the same concept where they do like this exit exam or whatever to tell us like how well you would do on the exam.
But it's not all the schools. It's not all the schools that do it.
That's what I'm saying.
Mm-hmm.
Well, maybe you're the only because most people I know them maybe they not go like I don't know.
Yeah.
Like whatever.
Yeah. I never do any. I like when I was doing clinicals, I hear the students say, "Oh, I'm gonna do that," and if I don't pass, then I can't do. Say, no, sir, because that. Huh?
When they say they don't pass,
some persons were saying if you don't pass, it's like you're not gonna be able to do the exam. I mean, I said that don't make no sense. So I don't really understand, huh? Yeah, but I never did any. I know she's probably taking a call or something, but I never did any prep or anything for my NP exam. I just did my regular courses, and then I studied and did that.
You know what? When I came here, and I was going to the NCLEX, because remember I didn't go through. I did it on my own. I didn't go through like a company or whatever, you know. And then when I was going to do the exam, like a lot of people here were telling me, "Oh, I needed to go back to school. I mean, it was some revision and pay people for review." I mean, I said, "Me must go pay people." I used the Mark Clinic thingy, and I used my review and this what's her name, Nurse
Sarah review. Yeah, I never did any of those. When I was gonna do the NCLEX.
I did. I'm gonna do the exam at one time. So there was this girl. I don't know where she come from.
It's just a money making thing for a lot of people.
Tell me, say, nurses who study outside the United States are not as competent as the.
She was
trying to get me to tell you something. That even fueled me more because I sent an email and I said, I said for you to make such a statement, and you know that nursing is universal. You understand? The ethics and the things may change based on like the legality. Part of it may change based on where you are, and for some places that the delegation
protocols and everything.
If you study about disease content, those things that for you to come and say, oh, like people who study like don't study in the United States or in those. Girl, I was so mad.
I never did any review course, any at all for anything. Not for the NCLEX. I never spent any extra money for anything. I just study, and whatever I study, I just go in and do the exam. Nobody never asked me about doing any review course. All the review course that you have is more for personal gain by different companies or different people as far as I'm concerned. You understand? So nothing is wrong with using those, but I just feel as though if you can study and you test well, then nothing is wrong with doing that. But if you need the extra push with some questions, then fine. But for me, I never did any for NCLEX.
Even some of these reviews, it's expensive, girl.
Exactly, it's expensive, and it's most of the time like huh? Yeah. And you read it and you study broadly, and then the thing about it with the review courses, you have to look at it that people are just gonna take a few points and just give you. So you don't want it to be a case where you spend $1,000 to do a review course. Yes, it's gonna prepare you for the exam, but at some point it's gonna make you feel as though you're narrow-minded. I don't think you're gonna. So go ahead and study broadly, as I always tell people. Study wide, understand the different, how you go about with certain things. Understand it. Take the time out and study and understand the pathophysiology, and don't look at it to say, oh, because it said this is the answer. In your mind, you're thinking that's the only answer that is out there. It's not so. You understand? And that's what the review courses most of the time are going to do. They're just going to give you one answer and say, okay, then this is it, and you move on to the next question. When really and truly, you're not supposed to be studying like that. So you study very wide, not so wide where you confuse yourself, but make sure you get adequate information. You can rationalize it and explain it to people. You understand? So when you go in the exam, at least you'll be able to answer the question. You understand? And then from there, but it's up to you if you want to do the review courses. But I don't think it was mandatory, and that was just it.
Like, you know, like NCLEX Master, they have like a not FNP Master, so they have like a I
The app.
pay for it, so like I do the app, so I do like questions daily.
Yeah.
You know, like the school provides. Like, me can't go back up.
Well, that app is fine. The FNP Mastery, because I have it on my phone. So like when you're on the go, it is something that is very easy to use. You understand? Because you get the rationals and everything there. So like if you're driving and you're sitting down, you know, with somebody, not really you driving, but you know, your passenger, you can easily be doing those questions. You understand? But if it's not something that, like a lot of the courses, as I say, is more, it just narrow your mind a little bit when it comes on to answering questions. So you just have to be careful with those. Make sure you go ahead and spend time and study. And if in the end you want to do those review courses, then fine. You understand? But I wouldn't say go ahead and rely on those review courses to say, okay, then you're going to prep yourself for the NCLEX or prep yourself for the NP. You understand? Because as I say, you have persons who.
I just educate myself, and let me tell you, I dedicate myself.
Exactly.
And I actively study. Not talk about like you study, read. Like I read wrong. You know what I mean? I don't just because when this girl was telling me about like her, I feel like, listen, you don't already narrow man if you tell me this foolishness. See how come confuse me?
Confuse. And that was just me all this time. I always just make sure I read to understand. And then if I feel like I want to do good questions afterward, then fine. But questions always come last. You have to understand the basis, and then know you can always go ahead and do whatever after. But it doesn't make sense to go there trying to study from the review courses that not giving you much answer. You understand? It might give you one and two answer, and that's it. And then you go in the exam. You probably pass the exam, but then you come out and you look like one of those fool nurse. Sorry, you come out and you look like you don't know how to critically, analyze certain things. You don't know how to rationalize certain things because you never get the basic, the basic knowledge or the idea behind something that you're studying. So just make sure you don't spend your money or waste your money thinking that the review courses are mandatory, because they're not. All right? You have persons who do review courses and them still fail the course because what? They never have the knowledge itself. You understand? Them never read widely to understand how diabetes, come about, or understanding the pathophysiology for diabetes, the management of diabetes. So make sure you're spending the time to do all of that, and then from there you can decide. You have persons who do the review course and fail it. You have persons who pass it, with it. I never did neither of the two of them, not one. So the capstone that you're talking about, I never did any. I just went through NP school, study, read, and then go and sit my exam. And it's the same thing for NCLEX. I had my years of experience in Jamaica, but it wasn't the basis for sitting the exam. You understand? So with that, I did use some books and just read on topics that I wasn't comfortable with in terms of with the management. And then from there, I go and sit the exam. So that was just it. Hi, Leon. Welcome. How are you doing? So just make sure you spend the time. Dedicate 3 months. If it means you're going to dedicate 6 months to studying, dedicate that time to studying. If it means that the last month you're going to say, okay, then that is the time when you're just going to be doing questions and answer because you feel as though you're ready now, then that 1 month you can go through and do all of your multiple choice. And if you want to do the review course, but don't feel as though, you're going to do this review course with this company or this person because they have this certain amount of pass mark. You still have to prepare yourself in order to go and do those review courses. All right, so just be mindful of that. Lady Lara Nurse, how are you doing? Yeah, so just do that, and then from there, I think you will do well in the exam. And not only for the exam, because you don't really want to say you pass the exam and then no, you can't take care of patients. You understand? Because you're putting up your license now for at risk. Your license is going to be at risk. You pass and you have your license, but you can't take care of patients. You can't rationalize certain things. You don't understand. You can't answer certain questions that probably the patient is going to be asking you, the relative is going to be asking you. And then you just look like, you just look like somebody that don't have any sense inside of the room with the patient. You understand? Before you know it, them tell us that them don't want you to be the nurse because you don't have a clue as to what you're doing. You don't want to be that person. So definitely go ahead and find the time, sit down and study, because it's not only the one exam you're studying towards. You understand? You want to make sure so you get the education, the knowledge itself. So whenever you step out into the real world, people can look at you and say, yes, you're a professional nurse. You know what you're about. All right. Yes, it's not a walkover. It's not a walkover. So sometimes I know a lot of times persons will say, oh yeah, it's easy because they passed the exam. Don't look at the person who is saying that, oh, them passed the exam at 75, because sometimes these persons that pass the exam at 75, them still don't know anything when they leave. You understand? You have persons who do the exam, the entire exam. And me is one of those persons. Yeah, I'm going to the exam and done all the question, the whole of the question I did. You understand? And me not done. You understand? But you have persons who do the entire exam and they're great nurses. You have some who are just not great nurses, and it's the same thing. You have persons who do 75 and they come out and then brag about it. And when they tell them to go and take care of the patient over there, them laugh. You understand? So the exam was easier than nursing school. Exactly, exactly. Yes, Leon, I'm in the U.S. here. So don't let it be a case where, you feel as though, oh, you're going to do the NCLEX and, you just need a few questions to pass and you just need to do this little review course and that's it. No, don't look at it like that. Go prepare. You're not only preparing for the license itself, you're preparing for the working world after. So when you get your license, when you go in and you start talking to your patient or somebody, the doctor asks you something, you can't easily just answer. You understand? It just a snaps up. You understand? Because you've already studied. You already study. And that's how some of the doctors then will decide whether or not they will work with you, Because if they realize you're thinking outside of the box, yeah, man, they will think you're a smart nurse and they will trust you with certain things. So when you say, doctor, the patient is having chest pain, can I go ahead and do this? The doctor will say yes. But if you're going to be the kind that is like every time the doctor says something, or you're waiting for the doctor to put in the order because you don't know what to do or you're not anticipating what to do, then every time you come to them, they're going to have a question mark beside you. You understand? They will second guess you because them don't think you are, let's just say, competent enough. Because certain things that you're supposed to know, that are supposed to be like, basic information, you probably don't know it. And those are the things that, when it comes on to being a strong nurse and all, those are things that people look at. So for me, going to school here, they train you to pass exam mostly. I have to learn a lot on the floor. Exactly, exactly. Because that's why I say I don't really like to precept students here, because sometimes I don't know if it's because of my training as well that, it seems as though it don't really make any sense sometimes, because when the students do come on the floor, for somebody in fourth year almost, graduating, you're 6 months later, you're going to be graduating, let's just say, depending on the time period that I would have met them. You understand? I feel as though for fourth year students, you're supposed to know how to put in a catheter, you're supposed to know how to put in an NG tube without even asking, the nurse for guidance. Those are things that should have mastered from your second year. You understand? Because fourth year, you're thinking about managing a floor. You're thinking about graduating, and then you're going to step out. We're not talking about the white cap anymore, but you're going to be stepping out the next day or two on the floor to take care of patients. We're not expecting that when you step out and you're becoming an RN, you're an RN now. At that time, you're going to say, oh, yeah, you need to learn how to do blood draw. Like, I'm not expecting that, because in school they said that you're not supposed to touch body fluid. So what kind of nurse we're out there training? If you're not supposed to be touching body fluid, what kind of nurse are we training? Like, we're not training nurses anymore. That's how I see it. We're not training nurses anymore because nursing, you have a lot of body fluid out there. Like, yeah, from first year straight up to fourth year, you're gonna be dealing with body fluid. So if you're not trained to touch body fluid, like, what kind of nurses are we doing? Like, are we just coming to clinicals to sit down and chart on computer for the whole time? Like, things like that. No, so I really like the whole percepting because how I percept is a little bit different. It's a little bit different, and a lot of times the students them not really want to do anything. I mean, I really have time for lazy people as far as me concerned. Sorry. Hi Val, thank you for tuning in. Angela, welcome, welcome, welcome. Sandra, Hubert. Yeah, so when you get onto the floor, yeah, you're supposed to get comfortable. You're supposed to get comfortable in third year, fourth year to go out, with taking care of the patient them at that time. Like, you're supposed to be comfortable at third year, fourth year with taking care of your patients. So that way, by the time you finish, you get your license, they put you on the floor. You're not supposed to hold back. I feel like you're holding back anybody. Can you imagine you walking around with an RN license? And you feel as though, oh, nurse, can you teach me how to do this? Can you show me how to do that? And you say, go and get an NG tube. And the nurse will say, what is that? Go and get a catheter kit. What is that? Like, things like that. No, sir. Cannot. Oh, no, we hardly do much in clinicals. Not going to lie. We learn most things on the floor here. That's just so sad. I am a geriatric nurse, and we often do that. Yeah, it's just so sad. A friend who helps nurse pass it. Okay, nice, nice. Make sure you send them over to my page as well, though, and have them subscribe and to my YT page. Oh, you understand? But that's just it. So the whole how they go about with teaching here, nursing. I couldn't do it. I couldn't do it. But I love teaching, but it's just hard here percepting. It's hard for me to perceive students. It's hard for me to perceive students. So yeah, but kudos to the ones that are percepting them. And I'm not an impatient person. I'm not impatient, like, no, I'm not impatient or anything like that. When it comes on to certain things, I can tolerate it, but there are certain things, as I say, if you spend 4 years in nursing school, I just find it hard to be like, they're teaching you certain things that you're supposed to already know from first year or second year in nursing school. Like, no, nah. And that's why sometimes, the patients will be like, oh, you're a nurse? And then they look and you say, oh, you're teaching this person. And then you're wondering why them face look so, or them say they don't want this person in there. Because they're not comfortable. I think they will be a little bit more comfortable when you're a student nurse because they know that you have to practice. They know you have to practice, But can you imagine you're going to tell them that, oh, I just graduated nursing school. Oh, this is the first time doing an IV. Oh, this is the first time doing an NG tube. They're not going to want you to do it. They're not going to want you to do it. Oh, he's in Kingston. I wonder if it is one of my teacher from NCU. Leon? I wonder if it's one of my teacher from NCU. Is it Mr. Bennett? From Bennett not there anymore, but there was another gentleman with Bennett. What's his name again? I'm gonna tell you. I don't remember his name. He's very quiet, fair skin, humble guy, older, adult. Yeah. So they used to do classes in Kingston. Mhm. But yeah, but So how long have you been a nurse, Lady Laro? Nurse? Oh, what time is it? Oh, 2:17. Need to go and pick up my son. Didn't even realize that the time is getting so late. Anyways, with TikTok, I can't be driving because TikTok will ban my page. Them say I'm violating, so I have to put the phone down. That's TikTok. TikTok is very safe, which is good. I like it. I'm not gonna complain. Not gonna complain. Oh, Lordy. You know, but thank you for liking up the live, Angela. All right. I'm going to rest you right here. Right here. I got this from TikTok. All right. And it seemed okay, except that, you know, when you put the phone up there, it's like just pulling down. So, you know, that's sturdy. Not that sturdy. But if you are into, I haven't really use it. Like, you know, it's up here, but I haven't really used it like that yet. But you're supposed to can move it all over, they say. Stuff like that. Yeah, you put your phone. So if you want to do like your selfie videos, then you can easily do that. Alright. See? That's really cool. Alright, let me start driving. I'm gonna go home and eat some food. I'm hungry. I am so hungry. And I'm having a headache as well. Oh God. Hi. How are you? Alright. Not a problem, Leon, not a problem. Enjoy your evening. Alright. Enjoy your evening, and I will see you in the next live. Remember to go onto my YT page, as I say. Go onto my YT page. It's ThinkNursing, one word, and bring all of your crew over there. Alright. Have them subscribe to my page and send it out to them friends and family and loved ones. Alright. So this drive is gonna be what? It is gonna be about 10 minutes or 15 minutes. Oh, I have to push it a little bit, because if not, then I'm gonna be paying a lot of money for, you know, some of them schools here, them charge you per, not per minute, but yeah. Where's my glasses? Them charge you so much dollars per every 5 minutes if you're late. Yeah. So it kind of forces you to pay for after school finishes at 3 o'clock for the morning. You say they call it 3 o'clockers. So my son would say, I'm now a 3 o'clocker because I stopped letting him stay after 3. Because my mom is here. So he's like, so I'm now a 3 o'clocker. Like, yep, you're a 3 o'clocker now. Because usually he will stay there and they'll play, they'll do, you know, assignments until, he could stay until 6 o'clock, but I don't normally let him stay there until 6 o'clock. By 4 o'clock, 4:30, I go for him. So he was sad when I told him that he's not going to be there with kids anymore.